Endometriosis is a little nebulous to somebody without medical training, but it's the growth of endometrial tissue outside the uterus. Essentially, it's a chronic condition that can lead to a lot of pain and other medical issues for people. There's three main symptoms when it comes to endometriosis: pain with periods, pain with sex, difficulty getting pregnant. How endometriosis occurs, we don't exactly know. I think there are a lot of theories. One of the most predominant theories is when women menstruate, it's supposed to all go through the cervix. About a good percentage of women, actually, some of it actually goes back through the fallopian tubes, and it's something called retrograde menstruation. There's a second component to endometriosis that is an altered immune response to that happening, that essentially the immune system starts to fight that endometriosis tissue in a way that causes a lot of inflammation and ultimately some of the things that happen with endometriosis. That altered immune response in part is genetic. In part, we worry about things in our environment, but I think we've honed in on it that a lot of women have a family history. So if somebody's sister or mom had endometriosis, they have a six-fold higher risk of having endometriosis themselves. I think the diagnosis of endometriosis oftentimes comes from taking the appropriate history from the patient and seeing what symptoms they have and how predominant they are. And then also sometimes it is something that we can get from medical tests like a pelvic ultrasound, or sometimes a surgical diagnosis when we do a laparoscopy. Endometriosis can have a negative effect on people's fertility. It can cause inflammation to come and go, and it can alter, in its severest form, it can alter transport of eggs and sperm and embryos, meaning blocking tubes. In its milder forms, it can impair or alter fertilization rates and implantation rates of an embryo. And so it doesn't always make somebody completely infertile, but rather just lower the efficiency of getting pregnant.